Our nation's veterans are facing a greater threat of homelessness due to the widespread economic impact of COVID-19. The U.S. Department of Veterans Affairs announced in May that it has expanded assistance to veterans experiencing homelessness or those who are at high risk. These funds come from the Coronavirus Aid, Relief, and Economic Security Act, also known as the CARES Act. The relief package allocates $17.2 billion for the Veterans Health Administration. $300 million of that money will be used this fiscal year to address challenges faced by at-risk vets. Now, joining us now is Dr. Keith Harris, National Director of Clinical Operations in the homeless program at the Veterans Administration. Dr. Harris, thanks for being with us. So how does VA help veterans and their families who may be facing homelessness or housing instability?
Well, I think the important thing to note right off the top is there's arguably never been a more dangerous time to be homeless. Two of the primary risk mitigation strategies are staying home and washing your hands. Both are effectively impossible when you're homeless. So at the VA, one of the big ways we're trying to help is identifying veterans that are out there on the streets, that are in parks, in encampments, and provide them a safe, stable place where they can socially isolate, and then we can provide additional services. A lot of those are coming in the form of hotel and motel placements. The other way we're really trying to help right now is around homelessness prevention, trying to keep people who are housed from losing their housing. We do that through rental assistance, utilities assistance, things like that.
Dr. Harris, how big of a factor was the CARES Act in expanding the VA's ability to help these veterans?
The CARES Act was really instrumental, a very big factor in our efforts. It did two primary things. One is it lifted funding limits that were in law for some of our programs, which allow us to then expand and really ramp up our services and provide the additional support that our homeless and at-risk veterans need. And then in your intro, you noted the other important thing it did, which provided funding to the VA, $300 million of which went to our grant programs that are paying for some of those hotel placements and other increased services.
And how has the VA, or how is the VA, working with Congress now to expand the capabilities?
So this has been a really big piece of the picture for us. People may not know, but there's a lot of things the VA can't provide directly to homeless veterans. We're a healthcare system, and by law, we can't provide some of the things like food, shelter, clothing directly. We have to do that through partnerships, which is a limiting factor on us. So the House and Senate Veterans Affairs Committees both approached us about changes needed in the law in order for us to do those things directly, and they introduced the Homeless Veteran Coronavirus Response Act last month. It has not been passed yet, but if it does, it'll provide us the ability to provide those things directly and significantly enhance our capacity to help homeless veterans.
All right, Dr. Keith Harris, National Director of the Clinical Operations for Homeless Program Office for the Veterans Administration. Thank you so much for being with us. We appreciate it.